Good morning, everyone. It's a real honor for me to be here today. All right, so today I'm going to talk about disparities in breast cancer. Um, so let's start by just defining what are health disparities. The National Cancer Institute defines disparities as adverse differences that exist among specific population groups in cancer incidence, how many new cases there are, cancer prevalence, how many cases are there within a population, how many people die, how many people survive, and the burden of cancer and other health-related conditions. And we can define these groups, when we talk about health disparities, by age, by race, by socioeconomic status, various categories to help us look at why there are differences among different segments of the population. So when we look at cancer overall in the US, what this slide shows, oh great, I have a pointer here. Let's see if I can work it. Great. What this slide shows is that when we look at new cancer cases, African Americans have the highest incidence and also the highest death rate from cancer compared to other groups. This slide just reviews some data looking at differences in incidence by different races. And so if we look here, white is in yellow, the black population is in red, American Indian is in green, Pacific Islander is in blue, and Hispanic is in purple. And so what we see is that whites have the highest incidence, or at least up until 2012, that was true. Paradoxically, however, even though blacks have historically had lower incidence of breast cancer, they've had a significantly higher death rate from that. And that's a paradox that we've seen over a number of years. However, recently, what we've seen is that when we look at new cancer cases in blacks and whites, that unfortunately, the number of new cases in blacks has almost inversely caught up to the number of new cases in whites. And what we're seeing with mortality, which is this gray bar, is that unfortunately this gap in mortality, cancer deaths between blacks and whites, is not shrinking, unfortunately. In fact, it's getting wider. We also see disparities in survival for women who are diagnosed with breast cancer. And we see that African Americans have a significantly lower percentage of women who survive for 5 years compared to several other groups. And this is just a graphic depiction of that, basically showing that that everyone is getting slightly better in terms of the number of women who survive 5 years. But unfortunately, what we're seeing is this gap between black and white, unfortunately, is not changing. This is a very busy slide, and I don't want you guys to worry about looking at the numbers. But what I want you guys to look at is this column is white, this column is African American and black. This column is Hispanics, this column is Asian, and this column is American Indian. And we have basically, I want you to just pay attention to the bolded numbers. The bolded numbers mean that there are basically more women in this category compared to whites. And what we see is that for the later stages of cancer, we see a higher percentage of women of color, African American black women, Hispanic women, Asian, and American Indian. And that's true for all stages and all subtypes. And then when we look at certain specific subtypes, we still see that the trend is generally that women of color are being diagnosed at later stages. And that has implications for this slide, which is basically treatment. And so what this shows, again, this column is white, this column shows African American and blacks, this shows Hispanics, this shows Asians, this shows American Indian. And what this shows, unfortunately, is that when we look at women who are getting appropriate treatment, The top column is people who are getting appropriate treatment. The bottom column is people who are getting inappropriate treatment. And unfortunately, among women of color, we see more inappropriate treatment for breast cancer, pretty much no matter what subtype you look at. And so when you kind of combine the later stage of diagnosis when it comes to women of color and the fact that we're often not getting what we call guideline concordant treatment or the most appropriate therapies, it's not surprising that the cancer death rates are higher for women of color. So the big question is why, right? When we look at health disparities research, we look at it and we have different what we call generations of health disparities research. So first generation is identifying that the differences exist, right? Second generation is looking at the causes, right? What's the mechanism? Why is this happening? And then the third generation research is looking at how can we actually address these causes to try to equalize the disparities that we see. So there are a number of reasons and causes of the disparities that we have been able to identify just by looking at sheer numbers. So when we look at income, unfortunately, women of lower socioeconomic status and who have lower income tend to do worse when it comes to early diagnosis of breast cancer and in terms of getting adequate treatment. We definitely think that differences in access make a difference, both in terms of insurance coverage, access to screening, and access to treatment. And people who have less access in terms of insurance coverage, but also in terms of where they're geographically located, we can see that that impacts your breast cancer outcomes. In women of color, there's a higher incidence of triple-negative breast cancer. I think Dr. Joseph probably talked about that particular subtype of breast cancer that we tend to see nearly twice as much in Black women compared to other groups. And it's a very aggressive form of breast cancer. And we think that part of the difference that we see in cancer death in response to therapy is the fact that that type of breast cancer occurs more in minority populations. Differences in tumor biology, where some studies demonstrate that kind of no matter what stage you are identified at, in some populations you're likely to have a more aggressive type of tumor. Genetics, and then lifestyle and reproductive experiences as they vary between communities. We know that there are certain lifestyle risk factors that certainly are associated with breast cancer. Eating red meat and animal fats, we think, is associated with increased risk of breast cancer. And we can talk about that a little bit more. But in terms of the fats that you consume, plant-based fats are definitely better for you in terms of your breast cancer risk. And then obesity is a very important contributor to cancer risk overall, but also to breast cancer risk. And we know that particularly among African American, Black, and Latino populations, there is a much higher prevalence of obesity compared to other groups that we think contribute to increased breast cancer risk, but also risk for other cancers as well. I've spoken largely about national data that we have due to lots of research that's been done. But when we look at New York City, disparities is a very important topic. One, because there are many of us here who care about eliminating those disparities. And what this slide shows, this is one of my favorite slides because it's a very simple slide, but it gives you lots of information. This column basically shows in 2008 that there were 2,600 deaths from cancer when you look when you look at white, black, Hispanic, and Asian New Yorkers from these kind of key cancers, colorectal, breast, and cervical cancer. So 2,500 deaths. This column over here shows if we were to eliminate disparities, okay, in cancer death, how many lives would be saved, okay? And so what they did was they said, okay, if blacks, right, who have the highest death rate from breast cancer, right, if we were to, find a way to get them so that they experience the lowest death rate, i.e. the death rate that's being experienced by Asians, if we were to somehow make that happen, we would save, right, 1,000 lives. That's 30% of the cancer deaths that we see in New York City. So addressing disparities is extremely important and an extremely doable thing. The National Cancer Institute actually cares very much about addressing disparities and eliminating differences in cancer outcomes. Their most recent strategic plan was really to find ways to ensure the best outcomes for everyone. And they have a very detailed strategic plan that I'm going to spare you the details of, but I wanted to focus on the one that focuses on overcoming cancer disparities. And they have these various strategies, and I just want to highlight a few. Understanding the factors that cause the differences that we see. That's something that many scientists are working on very, very hard. Work with communities to develop interventions targeted to the specific needs of underserved populations. One of the things that we know is, with the increased risk of cancer among underserved populations, part of that is due to often lack of engagement within those communities with healthcare systems, and particularly with primary care and cancer care. So what they're saying, and I agree wholeheartedly, is we need to figure out how to work with the people that we're trying to help. We can't solve this problem in isolation. We have to get out into the community, talk to community members, and try to figure out the best way to try to address some of these problems. So, along those lines, we here at NYU believe that there are really three things for us to focus on in terms of trying to address the disparities, and not only address them, but eliminate them. And we think outreach, where we actually go into communities and reach people who are often not represented in healthcare settings, and not only to talk to them to figure out the best way to address some of these problems, but also to reach them to actually offer services such as screening services, and to see what else we can do to try to address these disparities. Education, letting women know, when they need to be screened, how often they need to be screened, what are signs and symptoms they should be looking for, what puts you at higher risk. And then finally, navigation. We know that education is necessary but not sufficient, right? How many of us know, what to do, right, to take care of certain health problems, but for a whole host of reasons, we don't do it. So knowledge by itself is not enough. It also takes motivation sometimes, but sometimes navigation, right? And so knowing that I need to be screened doesn't help me if I don't know where I can go to get screened for what I can afford. And so that's why we think combining navigation with education and outreach is a really critical piece to trying to reach underserved populations. So I'm thrilled to be part of this event today, where hopefully we're providing some education, and we'll be talking more about some of our navigation strategies here at NYU. So thank you for your time and attention, and I think I may have gotten us back on track.